We're now on to chapter 10, which is kind of a hodgepodge putting together of three different things. We have the cardiovascular system, the immune system, and the lymphatic system. And it also talks a little bit about blood, because all of these different categories kind of pool together and are related in how they work and function. So first up, we're going to go through the organs and overall function of each one of these systems, and then we'll get into the medical terms. So when you think about the cardiovascular system, think about, going to exercise and doing cardio. What does that mean? What are the components? Here we have the heart is obviously the key player, but the heart is responsible for pumping all the blood. So you need the closed network of all the blood vessels that go to and from the heart. So this is going to include arteries, capillaries, and veins throughout the entire body. In terms of what the cardiovascular system does for you, it's kind of two separate pumps operating at the same time. You have, half of your heart, the right side, pumps the blood to the lungs so that it can get rid of carbon dioxide and pick up more oxygen. Then you have the left side that takes that, freshly oxygenated blood and pumps it to the rest of the body, as well as, starts to bring back the deoxygenated blood. With that, when the blood reaches the smallest type of vessel called capillaries, then there's an exchange, and there's an exchange of gases like oxygen and carbon dioxide, but also nutrients and waste products. All that takes place in those capillaries. And then, as I mentioned, we get rid of the carbon dioxide from our body through the veins that end up making their way back to the lungs so we can exhale that carbon dioxide waste. So overall, it's pumping blood to the body, exchanging gas and nutrients, and then also exchanging waste out of the body. So here's the picture of the heart. You've probably seen this before in other classes, and you can see there's a lot of labeling on here. I think it's important that you understand all of these labels here, and from everything from the aorta and pulmonary artery to the different chambers of the heart to the septum, as well as the different layers. So we have different cardium layers throughout the heart as well. So this diagram is going to be a very important one for you to know. Hint, hint. So the heart itself is a muscle. So it's a muscular organ about the size of your fist if you were to close it up. And it's located behind your breastbone or your sternum and in between the lungs. As we talked about in the last chapter, one side of the lungs has 3 lobes and the other has 2, as well as a space between the lungs, because that's where the heart is situated. And its job is to pump and then circulate the blood through the body. It's divided into upper chambers and lower chambers. The ones on top are called atria, and there's a right atrium and a left atrium. So remember, for directionality, you are looking in reference to the patient's right and left side. So on the diagram, when we look at the right side of the slide, for example, that's really the left atrium, and vice versa. It's the opposite because we want to take the point of view from the patient. The lower chambers are the ventricles, so we have a right and left ventricle also. One other thing that I didn't mention on the previous slide is a septum. There is a septum here. It's not specifically labeled, but it separates the right and left ventricle, because we learned last chapter that a septum is a wall. For instance, the nasal septum is the other area in which we saw that. Now we're on to the valves. There's a series of valves in the heart, and their job is to keep the blood flowing in one direction. It's kind of a one-way highway system for the blood. So what happens is when the blood flows through a particular chamber into another one, the valve closes to prevent any backflow, because you don't want your blood flowing in the wrong direction. And we have 2 kind of sets of valves for this. We have atrioventricular valves which pertain to the area separating the atrium from the ventricles. And they're called tricuspid and mitral. Mitral was also once called bicuspid because of the number of flaps involved. So the tricuspid, as you can imagine, is a flap composed of, 3 little sections, and the mitral is 2. And these lie between the atrium and ventricle on the right and left side, respectively. We also have semilunar valves, and these are the ones that are valves associated with entering or exiting the heart. You have a pulmonary valve, which is located in between the right ventricle and the pulmonary artery, which takes blood to the lungs, which is why pulmonary is used. And we also have an aortic valve, which is between the left ventricle and the aorta, which is where the blood is leaving the heart and going to be pumped to the rest of the body. The pericardium is a large sac that surrounds the heart. Its job is to basically act as a protective layer, as well as secreting a fluid that helps facilitate the movement of the heart. So you want to keep everything, lubricated and functionally moving so that you can have a maximum output from the heart. So the pericardium is kind of the outermost layer. The heart itself has 3 layers. There's the epicardium, which is the outermost covering. The myocardium, myo means muscle, so this is the middle muscular layer. And this is kind of the one that we talk about most when we talk about heart issues and issues with the heart muscle. You also have an endocardium, which is the inner lining of the heart. So here we kind of have a graphic that shows you the generic blood flow through the body. Blood vessels themselves are just any tube that's going to carry blood. So these include both arteries and veins. Artery, think away. Arteries are carrying blood away from the heart and either to the lungs or to the tissues. And in this case, usually it's going to be carrying oxygenated blood, which is why in the pictures it's showing you that it's red. Red signifies oxygenated blood. So from the aorta, which is the largest artery in the body, you pump blood out to the rest of the body into smaller and smaller vessels. So as they get smaller, we have atrioles, which are very small arteries, and then the smallest is capillaries, and that's where the gas exchange takes place. So the oxygen is going to leave the arteries and go into the tissues, and the tissues are then going to put the carbon dioxide waste into the blood. And I do want to make a special note here. The pulmonary artery does take blood away from the heart, but that's the one instance where it's carrying deoxygenated blood. It's carrying the blood with waste to the lungs so that you can expel that waste and pick up more oxygen. So the vein's job is then to take the deoxygenated blood, which is shown kind of in a bluish purple in the figures that have carbon dioxide instead, back to the heart, with the exception of the pulmonary vein that is taking blood back to the heart from the lungs, which just picked up oxygen. As you get smaller, on the small scale, from the capillaries you have venules, and then those venules begin to pool together into veins, and then the largest veins in your body are called vena cava. You have 2 of them. You have a superior one and an inferior one that are the 2 main veins entering the heart. So now we get into the function of what the blood actually does. So the blood's job is to act as a transport kind of highway along with the blood vessels to transport nutrients and waste and other things, as well as hormones, which we'll get into in chapter 16. It's a protectant. So it has cells in it that can protect you against microorganisms, which is where the immune system is going to come in, and we talk about antibodies. It's a regulator. Your blood helps you maintain temperature. your blood is warm, and as it circulates, it helps keep your extremities warm, which is why if you have poor circulation to your hands or feet, for example, you're oftentimes a lot more cold than other people. It helps maintain fluid. Your blood does carry excess fluids, and therefore can also contribute to electrolyte balancing as well. The blood itself is not just one thing. It's a heterogeneous mixture. There's a whole bunch of different things that are actually located in your blood. The liquid portion, which is, if you were to take a blood sample and spin it all out, you have, different types of cells, but then there's also liquid. That liquid is called plasma. And that's what the cells are suspended in. We have a few different types of cells. There's erythrocytes, and I believe we learned this word a long time ago. Erythro means red. So a erythrocyte is your red blood cell, and their job is to basically carry the oxygen. We have leukocytes, which are the white blood cells, and their job is to act as part of the immune system and combat infection. And thrombocytes. Thrombocytes are also called platelets, and their job is to help in the clotting process. For example, if you cut yourself, the thrombocytes and platelets kind of jump into action to help your blood clot so you stop bleeding. So here's kind of just a visual representation of that blood composition. So as an FYI, your blood is roughly about 8% of your entire body weight. And within there, in that test tube picture, you can see a little over half is plasma. And most of the plasma is water. There's a few other solutes like sodium and potassium and things like that, but it's mostly water. And then the cells are about the other half, and we have most of them being the red blood cells, the erythrocytes. But there are also a small amount of leukocytes and thrombocytes as well. This one is mostly just kind of an informational slide for you. So a separate but related system here is called the lymphatic system. And you can see it in the diagram as the series of kind of green vessels. And it's consisted of lymph. Lymph is similar to blood plasma. It's a liquid that flows through your body that's containing mostly white blood cells. So it acts as kind of a barrier against disease, if you will. It returns proteins and excess fluid back to the blood as well, and carries bacteria that it picks up to the lymph nodes, where those bacteria can then be destroyed. The key organs here include lymph nodes, spleen, and thymus, and I'll talk a little bit more about that later. So as I mentioned, the lymphatic system's job is to return excess fluid to the blood. So if you drink a ton of liquid, you don't want all that liquid going into your tissues. So the lymphatic system helps to flush that out and put it back into the blood so that you can then take it to your kidneys and expel it as waste. It collects extracellular fluid called lymph and gets it away from the body towards the heart and eventually kind of gets drained through the body. It also absorbs fat and vitamins and helps transport them to the blood and helps in the defense against infection. Like I mentioned on the last slide, it helps take bacteria to the lymph nodes, which are certain kind of hot spot areas in the body. One key example of lymph nodes is on either side of your neck, and that's kind of one key indicator how you know you're getting sick. If you feel on either side of your neck your lymph nodes become swollen because they're a high population of bacteria in those lymph nodes at that time. So this is just restating what I mentioned. Lymph itself is the colorless tissue similar to plasma, but it has a lot of lymphocytes, monocytes, white blood cells. The lymph vessels travel throughout the body. It also has a few key organs that it travels through as well, including the spleen or the thymus gland, your tonsils, And then the lymph nodes, which are small little bodies of lymph node tissue that act as a filter. There's the cervical ones are located in your neck, but you do have some in other places as well. For example, kind of right under your armpit, as well as in your pelvic area. The spleen is located on the left side of your abdominal cavity. It hangs out between your stomach and your diaphragm, so it's kind of on top of the stomach area right under the diaphragm. It's the largest lymphatic organ in your body. And just as an FYI, yes, if something happens, you can live without your spleen. We also have the thymus gland, which is located kind of by the heart area. So it is anterior to the ascending aorta and posterior to the sternum between the lungs. So it's right kind of above the heart and between the lungs. And it helps act as a key player in the immune system. Which leads us to the immune system. And there are not any specific organs or structures that are with the immune system only. The immune system pretty much uses organs and structures that other body systems use. So it depends on the spleen, the lymph nodes from the lymphatic system. It depends on the liver and the intestines and the bone marrow. So the immune system is kind of piggybacking off of other organs and structures in the body to help fight infection. So the overall job of the immune system is to protect from pathogens. Whether it's a bacteria or a virus or some kind of toxin, or even abnormal cells like cancer. And I put a picture on here so that you can kind of see what the different lines of defense are. This is more informational for you. So the first line of defense that we have as part of our immune system is really our skin. So our skin acts as a mechanical barrier to prevent certain pathogens from getting in. We also have saliva and earwax, which prevent pathogens from getting, into our mouth or ear area. If that doesn't work, our second line of defense is our part of our immune system. We have natural killer cells, protective proteins, as well as a fever and inflammation. Those are two things in which begin to occur in your body's effort to get rid of a pathogen. If that still doesn't work, then that's when the antibodies come into play. That's kind of our third line of defense. So I want you to think about here, how is the lymphatic system different than the immune system? Or are they really the same thing? They do play closely with one another. One of the lymphatic system's jobs is to help filter bacteria into the lymph nodes. So in that regard, the lymphatic system is aiding in using its own self as part of the immune system. But as I mentioned before, the immune system is really using organs from all the different other systems to get its job done. The lymphatic system has other functions that are in addition to its immune system role. All right, we are finally to the point where we can look at some combining forms. All right, so looking at most of these, they do go along with what they are, referencing. For example, here we have angio. Angio is one that means vessel. It's really a generic term, but most of the time it's talking about some kind of blood vessel. Aorta, O is your aorta. Arterio is an artery. So it really could be referencing any particular artery throughout the entire body. Atrio is an atrium. Cardio, I'm pretty sure you all know, is heart. Lympho means the lymph or lymph tissue. We also have lymphatino, Lymphatino is specifically for a lymph node. Myelo, in this case, means bone marrow. But I do want to draw your attention. We've seen myelo before. Myelo in chapter 15 means spinal cord. So depending on how the word is used, myelo means both spinal cord and bone marrow. Flebo and veno both mean vein. Most of the time you're going to see veno, but we'll see flebo a lot too. Plasmo is plasma. Spleno is spleen. Note how there are not two E's for spleno. Thymo is for the thymus gland. Valvo and valvulo both mean valves, so we're going to be using that to talk about the heart valves. And ventriculo means ventricle. So please take some time to add these words to your diagram so that you can use them to study. As I mentioned, that diagram is going to be really important to know. So continuing on with that, we do have some combining forms that go along with the structures. For example, athero. Athero means like a fatty yellowish plaque. So it has to do with a fat buildup, usually on an artery. For example, atherosclerosis is going to be a term that we see a little bit later on. Echo means sound, and that's really could apply to many different chapters, but we're going to use this here for an echocardiogram, for example, would be the recording of the heart's beating. Electro is electrical activity. So an electrocardiogram would be a monitoring of the electrical activity within the heart. Ischio. Ischio is a deficiency or blockage. This could apply to many different chapters, but here we're going to talk about the deficiency or blockage most likely with blood flow to the heart. Thermo is heat, as you can imagine, and thrombo references a thrombus or a blood clot. So this is where we talk about a clot forming within the blood vessels. A few new prefixes and suffixes. Brady means slow. So if you're saying bradycardia, for example, that would have to do with having a slow heartbeat. And we did learn last chapter the prefix tachy, T-A-C-H-Y, means fast. So tachycardia would be a fast heartbeat. So those two are kind of opposites that always go together, tachy and brady. Pan means all or total. And I know we saw this previously when we talked about panplegia, for example, which is total paralysis, which means you can't, move your body. Here we're going to see it a few different ways. Suffixes, we have AC, which means pertaining to, along with about 20 other things. Apheresis. Apheresis means removal. It's similar to ectomy, but we'll get into kind of what the difference is a little bit later. Penia is the abnormal reduction in number. Oftentimes this is talking about blood cells. So if you have a reduction in your red blood cells or white blood cells, that kind of thing. Poesis is formation. For example, erythropoiesis is the formation of new red blood cells. As your body continually makes new ones, they only live a certain amount of time. Sclerosis is hardening. And I believe we saw that one in the ear chapter when we talked about hardening of the stapes as one of the medical conditions. Which one of these terms means vein, arterio, flebo, or valvo? Even if you didn't know, you should be able to eliminate arterio and valvo because they don't even sound anything like vein. Flebo means vein, as well as veno. Okay, so here are the diseases and disorders, and I do want to draw your attention to how this particular chapter is laid out. It's a little bit different than other chapters because we're pooling a bunch together. So it's going to go through in each table the words for the cardiovascular system first, and then it's going to do the blood-related words, and then the lymphatic-related words. So it's not really in 100% alphabetical order. So here, these are the cardiovascular ones, and I'm really not going to go through each one specifically because you know how to put word parts together at this point. But just reviewing a few that we haven't seen in a while, sclerosis is one that we just talked about. It's hardening, but we have words like artery, arteriosclerosis and atherosclerosis, which is hardening of the artery or hardening of a plaque, which is usually on the artery wall. Stenosis is one we haven't seen in a little while. It means narrowing. So angiostenosis is a narrowing of a blood vessel. It's kind of a generic term. Aortic stenosis is specifically a narrowing of the aorta or the aortic valve. Other terms, megaly, if we remember, megaly is enlargement. So cardiomegaly is an enlargement of the heart. There's several different types of inflammation. You can have an inflammation in all the different layers of the heart, in a vein, in many veins, which is, many arteries or at many sites within the artery is polyarteritis. There's also thrombophlebitis, which is inflammation of a vein, which is phlebitis, but you add thrombo because that inflammation is caused or associated with a blood clot. So the clot is actually causing the inflammation of the vein. But the rest I think you can kind of put together on your own. And you can make sure to do exercise 12 or 13 to get some practice using these words. So here's really the rest of the list. On the left are the blood-associated words, and on the right are the lymphatic-associated words. Here we have erythrocytopenia, which, as we kind of talked about, is the reduction of red blood cells. But there is another term for erythrocytopenia. It's anemia. Anemia is another non-medical term word that means a reduction in the number of red blood cells. You can also have leukocytopenia, which could be leukopenia as well. Oftentimes they take out the cyto as part of the word because it's implied. Pancytopenia would mean that you have a reduction in all of your cells, not just a specific red or white cells. I think all the other ones are ones that you should be able to put together on your own. The lymphatic system is the same. You should be able to put all of those together on your own. Here's a picture of what aortic stenosis looks like. As we mentioned, stenosis has to do with a narrowing of the blood vessel. In this case, the aortic vessel or the aortic valve. This picture is showing you specifically the aortic valve. And so normally it's open to allow maximum blood flow through the aorta, which you want because it's responsible for pumping the blood to the entire rest of the body. And if that narrows or closes, then you lose that openness, and so blood has a harder time getting through, which can lead to circulation problems. Which of the following is broken down correctly? The term is atherosclerosis. Hopefully, by looking at this, you say A. Really the difference between all the choices is in how you would break down sclerosis. And even though there's an osis in there, sclerosis as a whole is considered one suffix. Okay, so now we are to the disease and disorder terms that are not built from word parts, which are notoriously hard to remember. The first of which is acute coronary syndrome. Basically what this means is there's a sudden, which is what acute means, a sudden onset of insufficient blood supply to the heart. So something has happened, there's a blockage or what, but there's not enough blood flowing to the heart. And usually what that indicates is a sudden heart attack, or myocardial infarction is the medical way to say that. An aneurysm. An aneurysm is the ballooning of a weakened artery. So this could be for a number of reasons. Again, you could have plaque buildup, you could have a clot or blockage. Regardless, there's a weakened part of an artery that starts to balloon up, and then an aneurysm could burst, and that's when you have a huge problem. So if that happens in your brain, for example, usually that would result in a fairly quick death. Angina pectoris. Use pectoris to help you realize that this is referencing the chest area. So this is chest pain, and it's called this because it's usually caused by insufficient blood supply to the heart. So it's kind of a referred pain to the chest. Arrhythmia, just think of a rhythm. It has to do with your heartbeat not being in the normal rhythm. So there's the normal lub depth that your heart is supposed to be, fulfilling, and if it's not doing that, if it's beating too fast or too slow or skipping beats, it's all different forms of an arrhythmia. Atrial fibrillation, or AFib, is one of those types of arrhythmia, and in this case it has to do with electrical impulses being kind of chaotic to the atria. So there's normally supposed to be a fairly regular signal to the atria to contract and then the ventricles to contract. And so in this particular case, the electrical impulses are not working quite correctly and not signaling the contraction correctly, so the atria are not contracting fully like they should. Cardiac arrest is the fancy way to say your heart is no longer beating. So at that point you would need CPR, or cardiopulmonary resuscitation. A cardiac tamponade has to do with a compression on the heart. So this is an acute situation where fluid is building up in the pericardial cavity. So in that cavity where the heart sits, fluid is building up, and then that excess fluid, as it accumulates, puts a lot of pressure on the heart, so it can't contract and expand like it normally would. Coarctation of the aorta is a congenital issue, meaning that you are born with it, and it has to do with a narrowing of the aorta. So in this particular condition, the narrowing of the aorta, which is responsible for pushing blood all the way throughout the rest of the body, is not able to, push out the same amount of blood as a normal person, which can lead to, several consequences. Congenital heart disease is another thing that you are born with. It's any kind of heart abnormality present at birth. There's a number of different abnormalities, from structural, something wrong with the heart itself, to electrical, with the electrical impulses, or heart size, all kinds of different things. Coronary artery disease, or CAD, is most often caused by atherosclerosis, or fatty plaque buildup in the arteries. But what happens is there's reduced blood flow through the arteries, and then that would eventually lead to decreased oxygen making its way to the tissues that it needs to. And eventually, if that's not treated, coronary artery disease often leads to heart failure or a heart attack. The next one, DVT, is deep vein thrombosis. That is where you have some kind of thrombus in a deep vein, meaning a very large vein within the body. And usually this happens in the legs, but not always. But a thrombus, if we remember, is a blood clot that breaks itself off and moves or travels. So in this case, whatever the blood clot is in the lower extremities breaks off, travels through the blood system, and then makes its way to the lungs, or then causing a pulmonary embolism. And the last one on this list is heart failure, or HF. It used to be called congestive heart failure. It means the same thing. But the idea is your heart is no longer living up to expectations. It's not pumping enough blood through the body that's needed to basically keep you alive. So it's not the same thing as cardiac arrest, where your heart stops altogether, but your heart is no longer working at a necessary level to keep you alive. Here's just a picture representation of what atrial fibrillation is. So on the left you can see the normal heart rhythm is called a sinus rhythm, and that's where the AV node there at the top sends electrical impulses for the atrium to contract first, and then the ventricles to contract. In the middle picture, atrial fibrillation, there's kind of messed up electrical signaling system. So the atria are just kind of sending signals back and forth to themselves and not really contracting and sending the message to the ventricles. And on the right, they're just telling you that of one technique in which to treat that disease. It's called atrial fibrillation ablation. They basically go in and laser kill the cells that are misfiring in the wrong direction. So this is what an abdominal aortic aneurysm looks like. In this case, the aorta, does pump blood down through the abdomen to the rest of the body and your lower extremities, and that artery is pretty large. So in this case, you can see kind of the zoomed in picture. There's a fatty plaque buildup, and that has caused the artery to kind of balloon out and the lining of that artery to weaken. So that's what the aneurysm would look like. And then if that bursts, you can imagine that there would be an extreme loss of blood and high likelihood of death. This is that congenital heart issue, coarctation of the aorta. Again, you can see the narrowing of the aorta there. This is something that an individual will be born with. It is treatable. They can go in and do some surgery to try to correct that, but it does lead to blood circulation issues because the maximum amount of blood is not being pumped from the heart to the body. Okay, continuing on with this big list, we have hypertensive heart disease, and this is a disorder basically if you have high blood pressure over a very long period of time. They categorize it as hypertensive heart disease. Hypertension is the medical way of saying that you have high blood pressure because it's putting excess tension on the blood vessel walls. Intermittent claudication is a term that has to do with your calf muscles, actually. So it's pain in your calf muscles while you walk. And really it's just a side effect of one of the later words, peripheral arterial disease, or PAD. And this has to do with a disease in your arteries of your arms and legs that basically means that they are blocked, usually by atherosclerosis, so the fatty plaque buildup in the arteries of the arms and legs, and then that can give you kind of intermittent pain, specifically maybe in your calf muscles, and that's where the claudication comes in. Next term is ischemia mitral valve stenosis. So as you can imagine, even though this is not from word parts, you should be able to understand that it's with the mitral valve and there's some kind of stenosis or narrowing involved. So here we have a narrowing of the mitral valve from scarring, usually. And then the ischemia is supposed to be on a separate line where you have a deficient blood flow due to some kind of obstruction. So there's a constriction or obstruction of a blood vessel and you're not getting blood flow. So usually that can lead to things like a heart attack or myocardial infarction, which is the next term, MI. Rheumatic heart disease is damage to the heart muscle or heart valves caused by rheumatic fever. And if you don't know what rheumatic fever is, it's basically an inflammatory disease caused by a strep infection. It's pretty common in children and young adults, but it affects the upper respiratory tract and can lead to issues or damage to the heart muscle or the mitral valve. The mitral valve stenosis is also usually caused by rheumatic fever. And then the last one, varicose veins, something nobody wants, are the distended veins found in the lower extremities. There's a picture of it in your book on page 405, but it has to do with not having proper blood flow through your veins. It happens more in women because we cross our legs and that kind of cuts off blood flow, which is why it's not good to cross your legs even though we do it. Alright, so here are the diseases and disorders from the blood and lymphatic system. So the first one is anemia, and this is where you have some kind of reduction in your red blood cells or erythrocytes, and it's actually caused by a whole bunch of different things. That it's in your book on page 406 where it kind of talks about the different ones, but it could either be blood loss, so maybe you had some kind of injury that could lead to anemia. It could be iron deficiency, or a few other, those are the two most common, or a few other different types. And the next term is embolus, or plural is emboli, and this is where you have a blood clot that occurs in the bloodstream, but it breaks off from its point of origin. It breaks off and travels in the bloodstream and then lodges itself or gets stuck somewhere else. And that's when you have something, for example, like a pulmonary embolism. Hemophilia is a blood disorder. It's an inheritable disorder, so you can pass it from one generation to the next. And it's a deficiency or mutation in a coagulation factor. And what that means is if you normally get cut, then coagulation factors help your blood clot and you stop bleeding. But these individuals do not have that, so they continue to bleed and their blood doesn't clot. So obviously they have to be, really careful about potential injuries. Next is leukemia, and most of you associate leukemia as kind of a cancer, but what it translates to is excessive increase of abnormal leukocytes. So the number of white blood cells skyrockets, and those are typically abnormal, meaning not traditional, most likely cancerous white blood cells. Sepsis is also called septicemia. They mean the same thing because it has to do with the bloodstream, but some kind of pathogenic microorganism has gotten into the bloodstream, which is a big issue because your blood travels throughout your whole body, which means the bacteria now has a highway to travel throughout your whole body system, and it causes kind of a full body infection. And then the ones on the right are from the lymphatic system. We have Hodgkin's disease, which is another malignant or cancerous disorder where the lymph nodes become enlarged. And then we have infectious mononucleosis. You guys know it as mono. It's an acute infection caused by the Epstein-Barr virus, and it attacks the lymph nodes. It gives you a sore throat, makes you tired, has a fever. But as you may or may not know, mono is also called the kissing disease because it's transferred mostly by saliva. Here are the surgical terms built from word parts, and they're mostly self-explanatory. One that might be a little tricky is end arteriectomy. It's a little bit tricky because it has endo, but the O has been removed because arterio starts with an A, so it looks a little different. And what that means is you have an excision from within an artery. In common practice, what that means is that oftentimes they cut an artery open and remove plaques, for example, and clean out the artery. Let's see. Another one is there's phlebectomy and phlebotomy. Phlebectomy is the excision of a vein, and then phlebotomy is incision into a vein. It's also called a venipuncture, but phlebotomy is something that is also an area of medical study. So anyone that draws blood is someone who is inserting a needle into the vein. So that would be a phlebotomist, for example. On the right we have removal of the spleen. If the spleen somehow is moved or shifted in an unwanted way, you can do a splenopexy and fixate it into place. And you can also remove the thymus gland. You can survive without a thymus gland or a spleen. Okay, now we're to the surgical terms that are not built from word parts, so I will go through each one of these. The first one is an aneurysmectomy, which is exactly how it sounds. It's just aneurysm is not technically a word part, but it's the removal of an aneurysm. Atrial fibrillation ablation. I kind of talked about this a little bit on the previous picture, but it is the procedure where you basically destroy using heat or freezing the cells that are not firing correctly and causing atrial fibrillation. A cardiac pacemaker. So this is a battery-operated device that's implanted under the skin, and then there are leads that come out of the device and go into the heart or in the chambers. And what this does is it treats an abnormal heart rhythm. So if your heartbeat is normally too slow, it keeps it so that your heart is beating at a faster pace. A coronary artery bypass graft is also called a CABG, and really that's whenever you have some kind of blocked off artery. They take an artery from somewhere else, usually your leg, and graft it or put it into your chest cavity. So it acts as kind of a bypassing the blockage so that the blood flow can actually begin to flow again. Because sometimes if there's a blockage, it's not easily repairable. So they do this technique to just circumvent the injured area. A coronary stent, it's kind of like a little mesh scaffolding that's implanted into the coronary artery. And what happens is it's put in, it expands, and it helps keep weakened or clogged arteries open so that they can have blood flow. Usually it's used to help prevent an artery from collapsing if there was an angioplasty or removal of plaque. Sometimes the walls of the artery can be kind of weak, so they use this to help keep it structured and open. Embolectomy is the removal of an embolus or a blood clot. There's different ways to do this, but that's what that procedure is. Femoropopliteal bypass. What this is, it has to do with the femur, obviously, so they are going to give a bypass similar to the CABG we saw before. Blood, an alternative route to travel from the femoral artery, which is kind of the major one that comes down and provides blood flow to the rest of the leg, and the popliteal artery, which kind of goes across the front of the knee. And there's a picture of it in your book on 414. Next we have implantable cardiac defibrillator, or ICD. So this one is something that's implanted similar to a pacemaker, but its job is to monitor your heart rhythm. And if it senses that your heart is too out of whack, it will give you an electrical shock to put you back into a normal sinus rhythm. An intracoronary thrombolytic therapy. So this is an injection of medication. Usually they give it intravenously or into the artery. And what it does is it dissolves blood clots before they get hardened. So usually what is done here is if someone is on their way to maybe having a heart attack due to a blocked vessel or blocked artery, they inject in this medicine whose job is basically to break apart potential blood clots so that you can reopen up that blood flow. The next is PTCA, or Percutaneous transluminal coronary angioplasty. Most of the time it's called a balloon angioplasty. So they take a catheter and insert it with a little balloon into a blocked artery. They inflate that balloon to push the plaques against the wall and kind of reopen up the artery. And it's on a slide later on in more detail. So here's the picture for what a CABG looks like, or a coronary artery bypass graft. In this procedure, they have a blocked artery within the heart, and they actually graft in another artery to kind of bypass it. A graft is just a piece of tissue or something that you remove from one part of the body and put it into another part. You can also have a graft from another person as well, and I think later on we talk about what those could be. Or we might have talked about it in the skin chapter too, because that's pretty common. But in this case, they've taken an artery, most likely from the leg, and inserted it here to kind of bypass whatever the blockage was, to kind of reinitiate blood flow. So here's what a coronary stent looks like. You can see in the top picture they have inserted the stent wherever there is a atherosclerotic plaque, so there's that yellow fatty buildup in this particular blood vessel wall. So they inserted it, and then they inflate a little balloon, and that balloon causes the stent to expand, and it compresses the plaques against the wall of the blood vessel. And then usually what they do is pull out the balloon and leave that stent in there, and that ensures that the blood vessel stays open and then reinitiates blood flow. Here's what the cardiac pacemaker looks like. Again, this is used to treat an abnormal heart rhythm, so it kind of monitors your heart beating and can then take effect if it is beating too slow, or even also sometimes used if you have an abnormal sinus node with abnormal electrical impulses. But the pacemaker apparatus itself is implanted right under the skin, as you can see on the left shoulder area, and then the leads are surgically implanted onto the epicardium, or outer layer of the heart, through a thoracotomy, so a small incision. Here is the implantable cardiac defibrillator. It's basically an implantable version of those giant defibrillator paddles. It goes in under the skin, and it continuously monitors your heart rhythm. And if the machine feels that a life-threatening arrhythmia occurs, it delivers a shock to try to jumpstart the heart back into a normal sinus rhythm. And you can see how it has the nodes or electrodes feeding down through the superior vena cava into the atrium and ventricles for that shocking purpose. Here you can see what a percutaneous transluminal coronary angioplasty looks like. So this has to do with usually atherosclerosis. There's buildup of plaque. So what they do is similar to the stent. They insert a balloon catheter positioned into that area. Then they inflate the balloon, but instead of having that mesh stent in, they just inflate the balloon to compress the plaque against the arterial walls and kind of open up that vessel. Then they deflate the balloon and then pull it out. And you can kind of see in the pictures B and C how B has before, and you can see with the arrow where there's a blockage, and then C where it gets reopened up. As I said, it's very similar to a stent, except you're not using that mesh stent itself and leaving it in. So which of the following is performed to remove fatty plaque from an artery? We have angioplasty, aneurysmectomy, and atherectomy. In this case, you'd want to choose C. C is actually removing the plaque. A usually has to do with fixing issues where plaque has built up, but it's not actually removing it. It's just compressing it against the walls of the artery. Okay, these have to do with surgical terms for the blood. So the first one is a bone marrow aspiration. It's pretty much the same thing as a bone marrow biopsy, except they're taking different parts of the bone marrow. In the aspiration, they're going to take part of the liquid portion. And both of these are usually done from the ilium, or that upper portion of the hip. And they use it to look for disease. Oftentimes, if they suspect maybe a cancer, they're going to do that. So the liquid portion is the aspiration. If they're taking a sample of the other part of the solid bone marrow, then it's called a bone marrow biopsy. And the last one is a bone marrow transplant. So someone with healthy bone marrow donates, and that bone marrow is then transplanted into some kind of donor. Usually cancer patients, for example, can get bone marrow transplants to help cure their cancers if they are related to the bone marrow itself. So you can see here kind of what that looks like. They take a giant needle. You would be knocked out for this. and they basically insert it into the bone, and in the bone there is the marrow, and they can suck out part of the liquid portion for an aspiration. For the biopsy, they would take part of the marrow solid part itself. We are now on to the diagnostic terms. Here are the ones for diagnostic imaging of the cardiovascular system. The first one is an angiography, and basically it's a radiographic picturing of the blood vessels. And there's a few different types, and your book kind of talks about what those different types are in more detail on page 419. I'm not going to specifically require that you know all the different ones, but it's just kind of a more for your information. And most of the time it just has to do with the way in which they go about looking at those. An angioscope is the actual instrument that they use to do a visual examination, and the angioscopy is the actual process. So the scope is the instrument that they use. Scopy is the process of actually looking at blood vessels. An aortogram is a radiographic image of the aorta. So, as noted on the slide here, an anteriogram, arteriogram, and venogram, all of them require contrast media to be injected. Otherwise, you won't be able to actually identify the blood vessels against the background. So they inject kind of this contrast media and then take an x-ray, and you can see on that image those key areas. In terms of procedures, there's a few different ones. One is an echocardiogram, and if you remember, echo is the sound. So here it's recording the heart's structure and motion using sound. So it's called an echo for short. And usually it's used to detect some kind of valve problem. So it's listening for the traditional lubbed up, the opening and closing of the valves, and it can give you an idea of heart function. Alternatively, there is an electrocardiogram, which is either called an ECG or EKG. They all mean the same thing, but it's recording the electrical activity. So it's not looking for the lubbed up sound of the heart. It's mostly looking at the electrical impulses. And so they use that instrument called an electrocardiograph to record it. The process of doing the recording is electrocardiography. So again, electrocardiography is the procedure, and you obtain an electrocardiogram with an electrocardiograph. Here's an example of what an ECG looks like. On the top you can kind of see the traditional beating of the heart, and in more detail on the bottom it kind of goes through one traditional heartbeat. And there are different letters associated. P, Q, R, S, T are the different portions of the heartbeat, and it also talks about diastole and systole, and I'm going to mention what those words mean in a little bit. In terms of diagnostic imaging, we have something called a digital subtraction angiography. This is kind of the one angiography that's important to know. What they do is they ingest some kind of contrast media, and they take an image of blood vessels and remove all the structures that are not being studied. So they can kind of flip the colors in terms of contrast of white and black, and it gives you a clear idea. I have a picture of it on the next slide. Doppler ultrasound is similar to an ultrasound that maybe you would get for a pregnant woman, but in this case they are looking for blood flow within vessels. It kind of gives an indicator of how blood is flowing, and it gives an idea of claudication, which is that calf pain. It can also give an indication of deep vein thrombosis or other blood flowing issues. An exercise stress test, or just a stress test, is something that people with potential cardiac problems have to do. It's a physical test where people ride on a bike or walk on a treadmill, and then they do a whole bunch of different things. And the idea is they're going to measure the cardiac function while you are exercising. So they might do an EKG and an echo and some kind of other scanning with you after you've done some strenuous exercise to get an idea of your heart function. Single photon emission computed tomography, or SPECT. I believe we talked about this one last chapter, but it's a nuclear medicine test, so there's contrast media, and you get a picture of the heart from all different angles using a CT scanner, and then they compile it together to give you a good picture of your heart health. We have a thallium test, and that's another test with nuclear medicine, and what they do is thallium is a radioactive isotope, and it's taken up by normal heart cells, but not by ones that have been deprived of blood flow or are blocked in some way. So it gives an idea of how blood is flowing through the heart and the heart as a whole. Usually they do it after someone maybe had a bypass surgery, just to make sure that blood flow has now been restored to the heart. The last one, transesophageal echocardiogram. This is an ultrasound test, and they use an ultrasound probe placed down through the mouth and the esophagus, and it's kind of another way in which they can assess heart function from that region. So here's what a digital subtraction angiogram looks like. This individual has been injected with some kind of contrast media, and that yields the top picture. So then what they do is they flip the coloring so the background is white, and all you see then is black for the arteries, and you can kind of see the blood flow, and it gives you an idea of if there's a blockage. It just makes things easier to see. All right, continuing on, we have cardiac catheterization. This is also called a coronary angiography. They mean the same thing, but the idea is you put a catheter into the heart and look at the condition of the heart and surrounding vessels. Impedance plethysmography measures venous flow of the extremities with something called a plethysmograph, and it's used to detect clots. So the idea is it measures blood volume and resistance in the vein, and it can give an idea if there's a deep vein blood clot somewhere. Blood pressure. Hopefully you know blood pressure is the amount of pressure that the blood is exerting on the blood vessel walls. And typically it's a 2-number readout. So there is a systolic pressure and a diastolic pressure. So the systolic pressure is when the heart is contracted, somewhere around 120, and diastolic is when it is relaxed, so it's a lower number. So something like 120/80 would be one example. Then we have pulse. Pulse has to do with the rhythmic expansion of an artery that goes along with the contraction of the heart. So you can feel it over the wrist, which is your radial artery. You can hear it out for your carotid artery in your neck, and you can feel it with your fingertips, that rhythmic pulsing. The last one is a sphygmomanometer. I'll say that one more time. Sphygmomanometer. And it is a device that's used for measuring your blood pressure. It's that blood pressure cuff. So that's the one that goes around your arm, and they pump it up, and you can then read out what your blood pressure is. So here's what that sphygmomanometer looks like. Again, it's the kind of the blood pressure cuff, and they pump it up, and then the doctor uses a stethoscope to listen for the heartbeat, and then gets a readout of your diastolic and systolic pressures. Now we are to different types of lab testing that you can do. The first one is called C-reactive protein, or CRP. And this is a blood test, and the idea is it's measuring the amount of C-reactive protein. It gives an indication of inflammation in the body. So when it goes up, then that assesses risk for cardiovascular disease. It means that your immune system is starting to respond. Creatine phosphokinase, or CPK, is another blood test. And this particular protein is an enzyme that's released into the blood when you get some kind of injury. So if this is elevated, that indicates that maybe you had a heart attack, for example. Homocysteine is another blood test where they measure for homocysteine, which is an amino acid, in the blood. And when it's elevated, it indicates another increased risk for cardiovascular disease. Lipid profile, I'll talk about this on the next slide too, but it measures the amount of all the different lipids you have in your blood, and it's used to evaluate the risk of developing cardiovascular disease. So this talks about HDLs, LDLs, and so on. Troponin is a final blood test here. Troponin is another enzyme that gets released into your blood about 3 hours after a death of part of the muscle, and it remains elevated for about a week. So this is another way that they test, in addition to other blood tests here, like the creatine phosphokinase, to test for heart attack. All right. For your blood, we have coagulation time, which is the way to say how long does it take your blood to clot if you get a cut. A complete blood count, or CBC, is a lab test that they do to measure out your total percentages of red blood cells, white blood cells, and platelets. And so it gives you an idea of health looking at those numbers. Hematocrit is a blood test that measures the amount or volume of your erythrocytes. So this is testing how many red blood cells you have. This is one of the key tests for anemia, so anyone who has a deficiency in red blood cells. Hemoglobin is testing the amount of oxygen-carrying components in your blood. So if you have a lower amount, that can give you some health information. And prothrombin time is the last term. This slide just talks about basically what a lipid profile is and what they're looking for. So the first one is cholesterol, and it's produced by the body and in a lot of foods, like animal fatty foods, and this could eventually lead to a buildup in your artery. So that's why having a lot of cholesterol is not very good. You have high-density lipoproteins and low-density hypoproteins. H kind of goes with healthy, L is kind of lethal, because the high-density one removes cholesterol from the tissues, whereas the low-density one transports it to the tissues and puts it in the arteries. So that's why having a high LDL is associated with atherosclerosis. So then when they measure your total cholesterol, they are measuring both the HDLs and LDLs. In addition, you have triglycerides, or TGs, and it's a kind of form of fat in your blood. It's made by the liver and it kind of stores energy, but may contribute to heart disease as well. You also have very low density lipoprotein, and it moves the triglycerides around in your blood. If it's too high, then it could be an elevated risk for coronary artery disease. Your book on page 226 shows you what a normal lipid profile looks like and what ranges are considered normal or high. So which measures the number of times per minute the heartbeat is felt on the wall? Hopefully you look at these answers and go with C, your pulse. Your pulse is measuring your beats per minute. Blood pressure is measuring the pressure on the wall. Okay, so here are all the complementary terms from word parts. You should be able to easily put these together. I'm not going to go through them individually, but I do want you to make sure that you at least try exercise 39 on using these words in context. So a patient diagnosed with leukemia would seek treatment from a hematologist, cardiologist, or phlebotomist. Well, leukemia has to do with the white blood cells in your blood, so you would see a blood doctor or a hematologist. It's not an issue with the heart, so you wouldn't see a cardiologist. And a phlebotomist really has to do with veins, so you wouldn't see that. So this picture is just showing you the placement of the defibrillator paddles. So you want to see how there's one on either side of the heart so that when you do shock the person, the electrical impulse goes across the heart, kind of from the atria to the ventricles, so that you can jumpstart the heart in the normal way that it works. Alright, last but not least, there are a ton of abbreviations from this chapter, and yes, you will be responsible for knowing what those abbreviations are. As always, please make sure that you practice actually putting these words into context. So, reading medical text with these vocabulary words and understanding what they mean.